Hey guys, welcome back. I'm just going to share something quick. So there's an easy way in which you can remember the minerals in perio. Okay, so the four minerals that are present are hydroxyapatite, which is at 58%. Then there's magnesium whitlockite, which is at 21%. And then there is octacalcium phosphate at 12%. Notice that is 21 and this is 12. And then there is brucite, which is at 9%. So brucite is the least and hydroxyapatite is the most. So the other thing you have to remember is which is present more in where. So whenever you see supragingival calculus in a patient, you go O. So that is O and H. So you see octacalcium phosphate and hydroxyapatite. And whenever you see subgingival calculus, you go So that is H and M. So you see hydroxyapatite and magnesium whitlockite. And since subgingival calculus has that is H and M, it has less of octacalcium phosphate and brucite. And also another thing you can remember it is, since mandibular anterior teeth are the smallest teeth, brucite being the smallest lettered mineral is present in the anterior teeth. And since the mandibular posterior teeth or posterior teeth in general are large teeth, it has the mineral with the largest name, that is magnesium whitlockite. So this was just a short 2-minute video. I hope this helped. And the other important thing that you could also remember is that hydroxyapatite is the mineral that is present in highest concentration. And then these minerals can be asked in a variety of ways, so it's very important. So this has been today's 2-minute tip, and I hope you like this. Please like, share and subscribe for more. Thank you. Have a nice day.